So now we're going to segue into talking about the long-term consequences of OASIS. So we're going to review associations between mode of delivery and pelvic floor dysfunction, focusing on bowel symptomatology, and review studies addressing bowel dysfunction after OASIS specifically. The first study I want to review with you is called the KP Cares study, and it was a male survey of over 4,000 women in California, 19% of whom were nulliparous, 10% who'd only undergone a C-section, and 71% who'd undergone at least one vaginal delivery. And this study was looking at the prevalence of pelvic floor disorders in each birth group, and this was just self-reported data. They did not examine these patients. And what they found was that there was a statistically significantly increased prevalence of anal incontinence, including accidental loss of liquid or solid stool or flatus, in the group of women who underwent a vaginal delivery as compared to those who were nulliparous or those who underwent a C-section. So in nulliparous or post-C-section women, the prevalence was 19% and 16% respectively, and in women who underwent vaginal delivery, the prevalence was 28% of anal incontinence. And when you looked at this in multivariate analysis, the adjusted odds ratios were significant only for vaginal delivery versus nulliparous women and for vaginal delivery versus cesarean section. So it does appear that vaginal delivery in and of itself leads to an increased risk of anal incontinence. Pregnancy, however, does not increase the odds of anal incontinence. Cesarean section does have a protective effect on anal incontinence in this study, and vaginal parity has a nearly twofold increased odds of anal incontinence compared to C-section. The other big U.S. study looking at mode of delivery is called the MOAD study, Mother's Outcomes After Delivery, and they recruited over 1,000 women 5 to 10 years after their first delivery, and they stratified into 5 different delivery groups: women who had a C-section without undergoing labor, women who had a C-section after labor, women who had a C-section after they'd gotten to be completely dilated, women who had a vaginal delivery without forceps, and then women who had an operative vaginal delivery. And they looked at the prevalence of pelvic floor disorders in each of these birth groups, and this was in addition to self-reported symptom data. They also collected objective measurements with POPQ. And so what they saw, and this is busy, but perhaps I highlighted, yes I did, you can see that the risk did gradually increase as you got to progressively more invasive birth groups. So if you had C-section without labor, that was the comparison group. And then if you had a C-section in labor, the relative risk, the odds ratio confidence intervals crossed 1. If you had a C-section at complete dilation, you see the odds ratio starting to increase, but still crossing 1. If vaginal delivery, the odds ratios continue to increase, but still not statistically significant. But once you get to an operative vaginal delivery, there you have it, statistically significant increased risk of anal incontinence. They then did a sub-analysis in the 449 women who had an operative vaginal delivery, looking at whether episiotomy, perineal laceration, and operative delivery were associated with pelvic floor disorders. And when they looked at anal incontinence specifically, none of these factors were associated with development of bowel symptoms. So that none of those are statistically significant for either operative delivery, episiotomy, or spontaneous laceration. So the MOAD study conclusions were that vaginal birth increased the odds of stress incontinence and prolapse to the hymen, and operative vaginal delivery increased the odds of all pelvic floor disorders, especially prolapse, and perineal laceration but not episiotomy increased the odds of pelvic floor disorders. So now I want to talk specifically about bowel dysfunction after OASIS, and this study looked at women in Sweden 3 to 8 years following OASIS, and it was a case control study of 136 primates, and essentially what they found was that anal incontinence was statistically significantly more prevalent in the case group, the people who had OASIS, compared to those who had a cesarean or a normal delivery, and the odds ratio was higher when you compared those cases to a cesarean than when you compared them to a normal delivery, but still OASIS was more damaging in terms of anal incontinence than just having a normal delivery without OASIS. In this study, this is kind of an interesting little diagram, and I apologize that the print is so small, but essentially they had 134 women for whom controls were available. Of those women, at 3 to 6 months after delivery, 41 had anal incontinence symptoms and 93 did not. So about 1/3 had some symptoms and 2/3 did not. And then over time, of the people who didn't have incontinence at 3 to 6 months, at 3 to 8 years later, you can see that 37 of them did have anal incontinence and 49 did not. So over time, these 93 women who didn't have symptoms 3 to 6 months after delivery, almost half of them went on to develop symptoms. In the group who had symptoms at 3 to 6 months after delivery, most continued to have symptoms. 8 resolved, 29 persisted. So you do see that you can somewhat predict that if you have symptoms here, you're probably going to have them here. But if you don't have symptoms here, it doesn't mean that you're in the clear, actually, because a significant number of women do develop symptoms as we follow them out longer. And that probably has a lot to do with the other things that happen to them over that time period. They put on weight, they get diabetes, their pelvic floor muscles get weaker. It's, we're not just looking, obviously these women aren't living in a vacuum where they just have a birth and then nothing else happens to them. So we're probably seeing that, but we do see that you would assume that, or you could assume, I don't know if you would, but you could assume that these similar things would be happening to both groups. But we do see that that if you had symptoms 3 to 6 months after delivery, you're more likely to have them 3 to 8 years later. This is another paper that came out of the MOAD study that I just wanted to go through in a little bit of detail. They took, in this study, they had 90 women who had an obstetric anal sphincter laceration, 320 women who delivered vaginally without a sphincter laceration, and 527 women who delivered by cesarean delivery. So they recruited these women 5 to 10 years after their first birth, and then they followed them prospectively. So in the 90 who had an anal sphincter injury at the time of their first birth, 42% of them had an operative delivery. And anal incontinence was higher in the group that had the operative vaginal delivery and OASIS than who had a spontaneous vaginal birth and OASIS. The group who had vaginal birth without an obstetric anal sphincter injury, there were 390 of them, and only 13% of those were operative deliveries, and their rate of anal incontinence was similar whether they had an operative delivery or a spontaneous vaginal birth. So it wasn't the operative delivery in itself, it was the anal sphincter injury with the operative delivery that really gives you more symptoms. And the comparison group for those was the C-section. And among the C-section, only 10% had anal incontinence. And interestingly, only 9% of any of these women sought care. There were significantly higher rates of flatal incontinence, stool incontinence, and pad use in the OASIS group, not surprisingly. And their quality of life impact was also higher. And significantly, there was poor maternal recall about obstetric anal sphincter injury, and that's certainly what I see in my clinical practice, that when I ask women, when women come to me in their 60s and they have pelvic floor disorders, and I ask about whether or not they had significant tears at the time of their delivery, they say, oh yes, I tore, I had an episiotomy, they stitched me up. But they don't know what was stitched up actually. Was it a 2nd degree laceration that was stitched up, or was it a 4th degree? They don't know. So this is just more data. These are just basically the tables from this paper because I think it's a really elegant paper. And this shows the differences in the groups at baseline. This is the table 1 in the paper. And you can see there is the only statistically significant difference is in obesity, which sort of makes sense. The obese women were more likely to deliver by cesarean section. They're also more likely to have problems with labor curve. And then this looks at various symptoms compared to delivery type, and I apologize, it's so small. But if you just go down the line here and you look at the first statistically significant p-value here, it's their anal incontinence score, and so higher is worse. And you can see that 19% in the group that had an OASIS had a high score versus only 9% in the C-section group, so almost twice as many. And then when you look at the question about do you ever lose lose gas beyond your control, it's 31% in the sphincter tear versus 15% in the C-section group. Similarly, we see a statistically significant difference in ever losing liquid stool beyond your control and in bother related to loss of liquid stool beyond your control. We see an increased risk of losing well-formed stool beyond your control. And then we see an increased risk of difficulty having bowel movements, but actually it's less difficulty having bowel movements if you had a sphincter tear than if you had a C-section. So what to make of that? Maybe they got constipated from their narcotics and it never wore off. And then you see statistically significant higher rates of pad use or changing your undergarments in the group who had a sphincter injury versus those who didn't. But they're not more likely to talk to their healthcare professional. They're more bothered, but they're not more likely to seek care. So there are some interesting things there to think about in how proactive we are in addressing our women who we know had an obstetric anal sphincter injury 5 years down the road, 10 years down the road, and checking in with them. How are things going? Because my other research shows that if we ask, they'll tell. But if we don't ask, they probably won't. And then this looks at impact on quality of life in these various groups. And what you see, these are all women who have bowel symptoms in these various groups, but you see a statistically significantly increased impact on quality of life in the group who had OASIS. So that's interesting, right? They all have bowel symptoms, but the ones who had OASIS have a more significant impact on their quality of life. Specifically in the domains of physical recreation, such as walking, swimming, or other exercise, entertainment activities like going to the movies or conference, ability to travel by car or bus more than 30 minutes from home, which probably has to do with urgency and inability to defer defecation, and then participating in social activities outside your home. Okay, this is a German study where they called people up on the telephone. They took people who delivered between 74 and 83 who had obstetric anal sphincter injury. They identified about 450 women who might be eligible. They called them up on the telephone. They got 22% of eligible women to complete their survey. So, you're limited by that response rate. But what they found was that 40% of those who did the survey had anal incontinence, 17% had fecal, and 35% had flatal incontinence. And this is also, I think, important to note, 76% of those who had fecal incontinence got it before menopause. So it wasn't necessarily that they were the women who pop up in their 50s and 60s. This is women who had the onset of symptoms before menopause. And maybe it happens once or twice and they hope it's going to go away and then they don't present to us until later. But I think we need to be thinking about that. They built some multivariate models to look at long-term bowel symptoms, specifically fecal incontinence, flatal incontinence, and incomplete evacuation. And operative vaginal delivery was statistically significantly associated with fecal incontinence. There was a trend towards forceps being worse than vacuum in terms of flatal incontinence, or worse than ventouse in terms of flatal incontinence, but it didn't reach statistical significance. And no other variables in this study were associated with long-term bowel symptoms, which doesn't really make sense with what we think about as risk factors for bowel symptoms, but maybe that's because we only had 22% of a response rate. Interestingly, these women, retrospectively, the vast majority still would have opted to deliver vaginally, even though they were now, somewhat significantly out from their vaginal birth with an obstetric anal sphincter injury, and now with bowel symptoms, still the vast majority would have still preferred to have had a vaginal birth. This is another study looking at bowel dysfunction decades after OASIS, and this was a cohort study of 125 women with complete anal sphincter rupture between 76 and 91, and 238 non-exposed Paris controls. They followed them for a mean of 22 years, and their mean age at follow-up was 50, and actually most of these women were still premenopausal, which is one of the limitations of this study. But what they found was that incontinence of flatus and liquid stool were more common in the OASIS group at all time points when they followed them up. They followed them up in 1989 and 1992, and then at a final follow-up. And obstetric anal sphincter injury was associated with an increased risk of fecal incontinence, but no other risk factors were identified. They did two separate models. They built one model that was just, if you look at the top half here, the Well, there's a little animation. If you look at the top half here, it's just sort of demographic data, whether or not they had an OASIS, their age, their BMI, their menopausal status, and the only statistically significant risk factor in those things among age and BMI and menopausal status was having an OASIS. They also built a model that was just looking at obstetric risk factors. Oh, excuse me. And again, the only statistically significant risk factor was OASIS when you looked at just a bunch of different obstetric risk factors. Interestingly, most of these women actually had pretty minor fecal incontinence. Not that any fecal incontinence is not bothersome. I mean, most people, even if it is just occasional, are very bothered. But a Wexner score, depending on who you read and how you dichotomize, you categorize severe as a score of 8 or 9 or greater. And so the majority of these women did not have severe fecal incontinence. And sort of not surprisingly, there was not a difference in fecal incontinence-related quality of life in these women who had obstetric anal sphincter injury or didn't. And then this is a really elegant study done by Dr. Brucha in the United States, which was a nested case control of a larger cohort study in Olmsted, Minnesota, looking at 68 women with fecal incontinence and 68 age-matched controls who agreed to do a survey and undergo a pelvic MRI. So they actually identified, I can't remember exactly, maybe 150 women with obstetric anal sphincter injury, but only 68 were willing to undergo a pelvic MRI. But so they had the opportunity to look at the correlates of the both subjective data from those women's reported symptoms and the objective data from the MRI. And they saw that internal sphincter injury was associated with fecal incontinence, as was reduced perineal descent. External anal sphincter injury and puborectalis injury were not predictive of fecal incontinence. Fecal urgency and stool consistency were predictive of fecal incontinence. And having had a 3rd or 4th degree episiotomy was a predictor of pelvic floor injury to the internal anal sphincter, external anal sphincter, or the puborectalis. Smokers were, so this is the argument, another argument why not to smoke when you're pregnant. Smokers are more likely to have external anal sphincter atrophy, even if they don't have other obstetric risk factors. And the age of development of fecal incontinence in this study was 40 to 59 in more than half, in about half of the population. And only 10% developed it before age 40. The prevalence of internal or external anal sphincter injury in asymptomatic women was about 10%, and it was 25 to 30% in women with fecal incontinence. And so they concluded that obstetrical trauma is a stronger risk factor for postpartum fecal incontinence than for delayed onset fecal incontinence. This study I just wanted to mention because I think it's an interesting concept to consider. This was a study of women with irritable bowel syndrome trying to determine whether is it the obstetric anal sphincter injury or is it the interaction of that with the bowel changes that happen when you have IBS, when you have constipation and diarrhea. And so there was a parent study about IBS, and then they got 70% of the women in the parent study to complete an interview about their bowel symptoms and their OB history. And they found that risk factors for fecal incontinence in this population of women with IBS included parity, operative vaginal delivery, obstetric anal sphincter injury, fecal urgency, diarrhea, and hysterectomy. Fecal incontinence was not associated with episiotomy, prolapse, or urinary incontinence, and the interaction between obstetric anal sphincter injury and bowel symptoms amplified their risk of fecal incontinence in the multivariate model. So there was this interaction where if you had OASIS and fecal urgency, your risk of fecal incontinence was increased nearly twofold compared to if you just had urgency alone. And if you had OASIS and diarrhea, you had a more than double risk of fecal incontinence, which sort of makes sense with what we think about the multifactorial nature of continence and how we maintain it. But the major limitation in this study is that the sphincter laceration data was by patient recall. So, which, like, I feel like none of my patients know whether or not they had a 3rd or 4th degree laceration. So I don't know exactly what to say about this. So in summary, OASIS appears to be associated with increased risk of both short-term and long-term bowel symptoms, and the risk of bowel symptoms after OASIS is likely higher after an operative vaginal delivery. The risk of bowel symptoms after OASIS is higher with other comorbidities like increasing age, white race, potentially diabetes and obesity, although studies are conflicting. And more research should really explore the mechanisms by which OASIS impacts both short and long-term bowel symptoms, because I don't think we understand it. Women with transient fecal incontinence or occult anal sphincter injury after their first vaginal delivery are at high risk of fecal incontinence after a second vaginal delivery. And that's all I have. And then I think we have one last talk about the combined clinic, and I'm going to let Paula come up and start that.